Hey followers, Dr. Sean here. What I'm doing now is just an unboxing. So if you can see, I've just received this package from Bristol University, and if I just look at the website, it's the T1DRA study. It's a type 1 diabetes risk study in adults. So I think there's a blood test in here, a finger prick test that I have to do, capillary finger prick test, and I have to send it off, and they're going to test my blood for whether I have not necessarily type 1 diabetes, but whether I'm at risk of getting type 1 diabetes. So for those who don't know what type 1 diabetes is, it's a serious lifelong autoimmune condition that affects about 400,000 people in the UK. So it occurs when the immune system destroys the insulin-producing cells in the pancreas. And that means that people can no longer take their own insulin, can no longer make their own insulin through the pancreas, and their blood sugar levels become dangerously high. And that is why they have to administer insulin shots. So a little bit of stats on it. More than half of type 1 diabetes patients are diagnosed in adulthood, but very little is known about how this condition develops. And even myself, when I was young or younger, I always thought that type 1 diabetes was always juvenile, so it was always some disease that kids get or young adolescents. But apparently more and more adults are now becoming type 1 diabetic. Not just type 2, but type 1 diabetes is a problem as well. So the T1DRA study, which I signed up to, is going to test blood samples in the general UK population for adults between the ages of 18 to 70 to assess their risk. And I had to do like a screening on whether I already want type 1 diabetes or some other risk factors. And if you pass the screening, then you qualify to become part of the study. So the T1DRA aims to find out how many people in the UK are at risk of developing type 1 diabetes, and to understand more about the immune changes before symptoms appear, before people become symptomatic and go to the doctor and then they get diagnosed. Adults identified in the study who have multiple risk markers, which they're going to be testing for, will be offered access to information about the symptoms of type 1 diabetes, its management, and the clinical trials testing new type 1 diabetes therapies. And as a scientist and researcher and somebody who's all in with personalized healthcare, empowering yourself with your own health management and getting involved and understanding things, I decided I'm going to be part of the study as a so-called healthy volunteer. Now we'll see what the blood results say when it comes back in about 6 to 8 weeks from now. So this is just unboxing, so let's have a look. It's, if unreturned, delivered to the Diabetes and Metabolism Learning and Research, Southmead Hospital, Bristol. I'm not sending this back, and I can't wait to see what's in. Oh. You used to always see people on YouTube do this unboxing of game consoles and various products and stuff. I wonder why they do these things. And that's the leaflet that came with study information. Capillary blood by finger prick test, kit instructions. You can scan the QR code for information, or watch our how to collect your sample video on the Bristol website. Basically tells you how to do it. What's included in the kit is a capillary blood collection tube, 2 single-use lancets to prick the skin, and a spare lancet for repeat use if required, 2 alcohol wipes, 2 gauze swabs, and 2 plasters. And then just instructions on how to collect the sample. Okay, front and back. Okay, and I think I will have to give it a go in a separate video. And there's the box, and I'm pretty sure in here they will remember to put this box into the prepaid envelope. Yep. And here are the goodies. There's the lancets. The sample goes in there. There's 2. I thought there was a spare one. They said there was a spare lancet. The wipes, the plasters. It only seems to be 2 lancets in here. And 1 blood sample collection tube. Participant study code. I have to fill this in. Do you have type 2 diabetes? I'll say no. I'm pre-diabetic, but I don't have type 2 diabetes yet. If yes, are you prescribed insulin? Yes or no? Please complete this form and return it with your sample. Date of sample. Time of sample. Okay. And this is for the lab to complete at the end. What else is in here? This for the specimen. Put the specimen in, transport it. And that's to send it back via the post. Alright, I think that's the unboxing of my test kit for my participation in the type 1 diabetes risk in adults test, which I will duly complete. And if you have any questions, let me know. I'll see how it goes, and when I get my results back, I will pop another video on to talk through my results. And if you are based in the UK and you are not type 1 diabetic and you're not on insulin, and you're interested in basically participating, you can always go to the type 1 diabetes risk in adults website at Bristol University. Watch the little video. There's a YouTube video that I will link to this video for you to watch, and I will also, in the description of this video, I will include a link to this web page. And I think the more people we have doing this, the more data we can collect, and we can get a snapshot of what's happening with type 1 diabetes in adults, because the focus seems to be obviously a lot on type 2 diabetes as an adult disease and linked to obesity, our lifestyles, the type of food we eat. But I do remember reading somewhere that there's a higher prevalence of people being diagnosed with type 1 diabetes now, especially in adulthood, than ever before. So this will help get like the numbers in, so we can try and understand what the picture looks like in the UK regarding type 1 diabetes in adults. All right. Thank you for watching, and I'll chat to you soon. Bye.